I'll have young kids that'll turn up on Monday that have taken a pill on Saturday, and they've probably only used use every weekend or every couple of weeks, once a month, and all of a sudden they've got an unknown substance, and they're having a psychotic episode, and they think they can read my brain. You know, they come in, they go, "Is it normal to see through you and to be able to read your mind?"
Wow.
And that's pretty scary stuff.
What do addicts believe is the best way to treat them?
Well, abstinence is the best way to treat any drug problem. If you've got a drug problem, stop taking drugs. That's very simple.
Yeah, but how? Well, it's simple in theory, but how in practice?
You need to be in residential care. I have not yet seen any successful outpatient speed users. You know, they've usually come in for a couple of weeks at least. I've got one young guy that's done all right after a 2-week admission, but most of them have got to be there 3 to 6 months. To have any... This is addicts, you know. I think what's happening too is we're not targeting education in the places that users are, you know, like on the back of dunny doors, you know.
So like we see with the cigarette campaigns, on the cigarette packages, you've got those horrific images of someone with throat cancer.
But you're hardly going to get that on a drug
dealer's not going to put on a foil and say, "Hey, this is going to kill you."
But what do we do? The government does seem to be targeting the supply of drugs quite well. How much more education needs to go into teaching users how to get off this track?
Well, there's user organisations. We've got a conference coming up. Annex has got a conference coming up. We're starting to have more dialogue. We're starting to talk more about this. And what other, you know, I think the only way to get out there is to go to venues where you can get to users direct. You know, and young people in nightclubs and pubs and dives. That's where we need to educate them, because this is serious stuff. This will damage brains. It won't necessarily kill you, but it will damage you for the rest of your life.
You're going to be speaking at the Australasian Amphetamine Conference in Sydney on Thursday.
That's correct.
What will be the thrust of your speech?
Mine will be about we need to change treatment modalities. We need to look at how we're treating these clients, that we need to spend more time with them. You know, there's no use having cognitive behavioural therapy when they're deluded, when they're insane. You know, we need to have time for them to chill out, then to be able to absorb that process of recovery. So I'm going to be talking about residential treatment, what we do, what are the methods of treatment.
Is the law efficient?
Look, the law does what they can. It's like any drug, you know. They can only stop a certain percentage coming through the door. And I think Chris Ellison outlined the strategies that they're using internationally and domestically. They're doing a good job, but reducing supply is not what it's about. I think it's about helping reduce demand and about treating what's there. You know, like I've seen in the past, 90% of the resources in the government go to 10% of the problem. That's policing. You know, 90% of the funding should go to treatment and education. Should be the other way around.
In schools, as young as, you know, high school or primary?
I think there's a role for education in schools, but I think it's more like direct it when people are out there partying. You know, realise that it's not as cool as you think it is, because it's... I describe it sometimes to people, it's like getting a red-hot poker and poking it through your ear. You're burning brain cells.
So it does, your brain.
Yeah.
Doesn't it? Long-term effects.
There's a whole lot of issues that happen. It's, you know, as I mentioned once on this show before, I've never been threatened. In 21 years of treating people, I've never ever been threatened. My life's never been threatened. In the last 3 years, or 2 years, I've had my life threatened 3 times by people who I'm helping.
Yeah, and they're crazed, and they've got this extraordinary strength as well, right?
Extraordinary strength. They believe they know everything.
Yeah.
You know, it's an incredible drug to try and treat.
I mean, we possibly discussed this before too, but is it possible to actually eradicate this problem?
No. Society uses drugs. Quite simply, we use drugs. We've got to change our attitude towards how we deal with them. And I think my definition of insanity is if we keep trying the same methods and expect different results, you're insane. We've been trying the same methods for a long time.
So what advice do we have for parents out there who might be struggling with a child at home that they're aware is going out on the weekends, popping pills, smoking ice? What do they do?
Certainly drug helplines in every state. You know, make the phone call, start the action, start to get in touch with family support groups. Look at how you can intervene in your child's drug use, because you can intervene. You can actually help them head towards a recovery process or head towards ceasing the use. So contact your local drug information services. you know, get on our website. We can, you know, talk to us. We'll refer you to somewhere in locally.
Yeah.
You know, it's really about start that process. Just get on the phone, and I would say that the majority of parents will have children using psychostimulants.
It's frightening. It's a scary, scary trend. But look, Richard, thanks so much for your time
thank you,
today.
Richard. Lovely to see you again, as always.
Great, thanks.
Thanks again. And there'll be more of us when we return.